Nutrition is a concern for all healthcare professions, and if we think back to the days of Florence Nightingale, she was the first person that observed that patients starve in the midst of plenty, and she, in her notes on nursing, had listed several key interventions that nurses should be doing to ensure that the patient's nutritional needs were met. It's estimated that 40 to 60% of hospitalized older adults are either at risk for malnutrition during hospitalization or are malnourished during hospitalization. Those are from studies, taken from research studies on hospitalized older adults. We don't have national prevalence or incidence rates of malnutrition either on admission or upon discharge. As you age, you're exposed to a lot of physiological changes in your body, dietary risk factors, social risk factors that you don't see in the younger adult. So when you begin to assess for malnutrition, you not only need to look at somebody's weight and height, you want to start assessing for the risk factors that could predispose them to poor nutrition. Today in the United States, the Joint Commission requires that a nutritional assessment or a nutrition screen be performed within 24 hours of admission on all patients admitted to an acute care facility. The mini nutritional assessment is comprised of 18 items. The first 6 of the items are considered the screening component of the assessment tool. If patients score high on that and are considered at risk, then they move on and they administer the complete mini nutritional assessment. Or they would then refer them at that point for a dietary consult so that they could do a more in-depth assessment. The scores on the complete version of the M&A, the full 18-item version, range from 0 to 30.